Let me start with something I see a lot. People come in and say, I just want to check everything, scan my whole body, I want to be safe. And I understand that feeling. It sounds smart, it sounds careful. But here's the truth. More testing is not always better. In fact, sometimes it can quietly lead you down a road you never needed to take. Full body scans, when there is no clear reason, can do more harm than good. Not because the machines are bad. They are powerful, very powerful. And that's exactly the issue. They pick up everything, even tiny things that may never cause a problem in your life. Now imagine this. You feel fine. You sleep okay. You eat okay. You live your normal life. Then you get a scan, and suddenly there's a spot. Maybe very small, maybe unclear. But now it has a name. And once something has a name, it starts to live in your mind. You start to worry. Your family starts to worry. And the next step is almost always more testing. Another scan. Maybe a biopsy, maybe a procedure. Each step sounds reasonable, but each step also carries its own risk. I've seen people go from feeling perfectly healthy to being stuck in months of tests. Not because they were sick, but because something tiny was found by chance. Something that may have never grown, never spread, never caused pain. As we get older, this matters even more. After 65, the body changes. Healing is slower. The risks from procedures go up. So when we chase every small finding, we are not always helping. Sometimes we are adding stress to a body that needs calm. There is also something else people don't talk about enough. False alarms. These scans can show things that look serious but are not. Still, once it's there on the report, it's hard to ignore, so you go deeper. More tests, more waiting, more fear. And that waiting, it can be heavy. Days turn into weeks. You check your phone. You think about worst-case ideas. Sleep becomes harder. Appetite changes. All from something that may never have mattered in the first place. Now, I'm not saying scans are useless. They save lives when used the right way. If you have symptoms, if something feels off, if there's a real reason, then yes. Testing is important. Very important. But doing it just to be sure when nothing is wrong, that's where we need to be careful. Good medicine is not about doing everything. It's about doing what truly helps. It's about knowing when to act and when to step back. After 65, the goal shifts a little. It's not just about finding disease. It's about protecting your daily life, your energy, your peace of mind, your ability to enjoy simple things. Walking, talking, eating with family, sleeping without worry. When we overtest, we can take some of that away, not on purpose. But it happens. I always tell people this. A test should have a clear purpose. Ask yourself, if this test finds something, what will we do next? And also ask, will that next step make my life better or just more complicated? These are simple questions, but they can save you from a long chain of stress. Sometimes the best care is not more action. It's thoughtful action. It's choosing wisely. It's saying, right now I feel okay. Let's not go looking for problems that may never exist. Because once you start that search without a reason, it's hard to stop. And at this stage of life, peace is just as important as prevention. So don't chase every test. Choose the ones that truly matter. Now let's talk about something many men ask about, the PSA test. I hear it all the time. Should I keep checking it every year? It sounds simple. A blood test. Quick. Easy. Feels like the safe thing to do, but after 65, it's not always that simple. The PSA test looks for signs linked to the prostate. And yes, it can help find cancer. But here is the part people don't always hear. Not every prostate cancer is dangerous. In fact, many grow very slowly. So slowly that they never cause harm during a man's lifetime. Now think about that for a moment. You could have a small, slow-growing issue and live your whole life without it ever affecting you. No pain, no symptoms, no problem. But once a test finds it, everything changes. Because now it has a label, and once that label is there, it's very hard to ignore. Even if it's low risk, even if it may never grow. The mind doesn't rest easy with the word cancer. So what happens next? More tests? More visits? Sometimes a biopsy. And a biopsy is not nothing. It can cause pain, it can cause bleeding. There is even a risk of infection. For an older body, that risk matters more. And then, in some cases, treatment is offered surgery, radiation. These sound like strong solutions, but they come with real side effects problems with urination, loss of control, changes in sexual function. These are not small things, they affect daily life, confidence, comfort. Now, here is the key point. Some of these treatments may not even extend life in older men with slow growing disease. So, you end up trading quality of life for something that may not have needed action at all. That's why this test should never be automatic at this age. It should be a conversation, a real one. Not just, let's do the test, but why are we doing it? What will we do if it's high? Do the risks of knowing outweigh the benefits for you? Because every person is different. Some men have symptoms, trouble passing urine, pain, changes they can feel. In those cases, testing makes sense. It helps guide care. That's a clear reason. Some men have a strong family history, close relatives with serious prostate cancer. That changes the picture too. It may be worth watching more closely, but for many men who feel fine, no symptoms, no strong risk. Doing this test again and again can open a door that leads to worry more than help. I've seen men come in relaxed, living their normal life, and after one blood test, everything shifts. They start thinking about worst outcomes. They lose sleep. They feel pressure to act fast. But slow problems don't need rushed decisions. And sometimes they don't need action at all, just careful watching, or even no action. This is the part people struggle with. Doing less feels like doing nothing, but that's not true. Choosing not to test or to test less often can be a very smart decision. It's a choice to protect your peace, your comfort, your day-to-day life. After 65, health is not just about adding years, it's about how those years feel. Can you move well, sleep well, enjoy food, spend time without worry sitting in the back of your mind? If a test is likely to bring stress without clear benefit, then it's worth pausing. Ask questions. Take your time. There is no rush if there are no symptoms. And remember this, a number on a report is not the whole story. You are more than that number. Your life is more than that number. So don't let one test decide everything without a full, honest talk first. Because sometimes the smartest move is knowing when not to look. Now let's talk about colonoscopies. This is one of those tests people hear about and instantly feel nervous. And I get it. It's not a test people look forward to, but at the same time, it is an important one in the right situation. The problem is not the test itself. The problem is when it is done too often without a clear reason, especially after 65. Let me explain it in a simple way. A colonoscopy is used to look inside the colon. It helps find things like polyps or early signs of cancer. When used at the right time, it can save lives. No doubt about that. But medicine is always about balance. Timing matters a lot. If a person has had a normal colonoscopy before and there are no symptoms and no strong risk factors, repeating it too soon may not add real benefit. Instead, it can bring new risks. Now, many people don't think about that part, but every procedure has stress on the body, even if it's safe most of the time. At younger ages, the body handles it better, but after 65, things change. Recovery is slower, the body is more sensitive, even small complications can feel bigger. There is also preparation. People often forget this part. The cleansing process before a colonoscopy is not easy. It can be tiring. It can weaken you for a short time. For older adults, that can sometimes lead to dehydration or imbalance in the body. And then there is the procedure itself. It is generally safe, yes, but there are still small risks. Bleeding, perforation, which means a small tear in the colon. It is rare, but the risk increases slightly with age. So now you have to ask a simple question. Is repeating this test again and again giving you more protection or just more risk? That's the real thinking point. Because many times, if the last test was clear and there are no new symptoms like blood in stool, sudden weight loss, or ongoing pain, then rushing into another colonoscopy may not change anything important. Instead, it may only add stress and discomfort. I've seen people who are doing fine, living normally, eating well, no issues. And then they are told, it's time again for another scope. And suddenly their mind shifts. They start worrying days before the test. They feel anxious, they lose sleep, not because something is wrong, but because the idea of the procedure itself creates stress. And that stress matters, especially at this age, because the goal is not just to find problems. The goal is also to protect your strength and comfort in daily life. Now, let me be clear. If there are warning signs, this test is very important. If there is bleeding, changes in bowel habits, unexplained weakness, or family history of colon cancer, then yes, it should be done. No delay there. But routine repetition without a clear reason is where we need to be careful. Sometimes people think more checking means more safety, but that is not always true. In older age, more checking can sometimes mean more exposure to risk, not less. It's like checking a clean room again and again, even when nothing has changed. You are not adding safety. You are just adding disturbance. Good medical care is not about doing everything possible. It is about doing what is necessary at the right time for the right reason. And after 65, that becomes even more important. Because at this stage of life, the focus slowly shifts. It is not only about finding hidden disease, it is also about preserving energy, avoiding unnecessary stress, keeping life simple and steady. A colonoscopy is a strong tool, it has its place, but it should not become a routine without purpose. Every test should answer a question, not create new confusion. So before repeating it, always ask yourself very simply, what are we looking for this time that we didn't already know? If there is no clear answer, then it may be better to pause and wait, because sometimes the best protection is not another test. It is knowing when to step back and not rush. And that choice can make a real difference in how peaceful your later years feel. Now, let's talk about heart stress tests. This is another one that sounds very responsible on paper. You hear heart test and you immediately think, yes, this must be important. It feels like something you should do every year just to stay safe. But after 65, we need to look at it a bit more carefully. A stress test checks how your heart works when it is pushed a little harder, usually through walking on a treadmill or sometimes with medicine that simulates exercise. It helps find blocked arteries or reduced blood flow. Now, here's the key point. This test is very useful when there are symptoms. If someone has chest pain, if someone feels short of breath while doing normal activity, if there is unexplained tiredness that is new. In those cases, it makes perfect sense. It helps guide real decisions. But when there are no symptoms at all, doing this test every year just as a routine is not always helpful. And here is why. As we get older, the body changes. The heart also changes slowly over time. Small changes can appear on tests, even when a person feels completely fine. These changes are not always dangerous, but the test can sometimes make them look more serious than they really are. And that's where the problem begins. Once something shows up on a stress test, even if it is small or unclear, it often leads to more steps. Maybe a CT scan, maybe an angiogram, maybe even a procedure. Now, those next steps are not small. They come with real risks, especially in older age. An angiogram, for example, involves entering the body through a blood vessel. It is usually safe, but it is still a procedure. There is a small risk of bleeding. There is a small risk of kidney strain from contrast dye. These risks increase as we age. So the question becomes simple. Did we really need to go there in the first place? I've seen people who feel perfectly fine. They walk, they eat, they live their normal life, no chest pain, no warning signs, and then a routine stress test is done. Something slightly abnormal shows up, and suddenly the whole situation changes. Now they are worried. Now they are going for more tests. Now they are thinking about things they were never thinking about before. And sometimes after all that, it turns out to be nothing serious. Just a small variation, a false alarm, something that would never have caused trouble in daily life. But the stress it created was real. That is something we must not ignore. Because after 65, quality of life becomes very important. Not just in terms of physical health, but mental peace too. Constant testing without clear reason can slowly take that peace away. It can make a person feel like they are always one step away from a problem, even when they are actually okay. Now, let me be very clear here. If there are symptoms, this test is valuable. if a person feels chest pressure while walking, if climbing stairs suddenly becomes hard, if there is a change that wasn't there before, then yes, we need to check. That is smart care. But doing it regularly without any reason, just as a habit, is not always helpful. Some people believe more testing means more protection. But in reality, protection comes from using the right test at the right time, not from repeating tests when nothing has changed. Think of it like checking your door lock again and again, even when you are already inside the house. It doesn't make you safer. It just adds unnecessary worry. The heart is strong, and it speaks through symptoms. When it needs attention, it usually gives signs. We should listen to those signs, not chase hidden problems when there is no signal. After 65, the goal is not to live in constant testing mode. The goal is to live with awareness, not fear. To know when something feels off and when things are actually stable. Because stability is also health, and it deserves respect. So before going for a routine stress test, always ask a simple question. Do I have any real reason for this today? If the answer is no, then it may be better to pause and not rush into it. Because sometimes the smartest way to protect your heart is not to keep testing it when it is already doing fine. Now let's talk about bone density tests. This is something many people start getting after 60, and it continues into older age. The idea behind it is simple. We want to check how strong the bones are. We want to see the risk of fractures. And yes, that matters a lot as we get older. Strong bones mean independence. It means being able to walk, move, and live without fear of breaking something from a small fall. So the test itself is not the issue. The issue is how often it is repeated without a clear reason. Let me explain. A bone density scan shows how dense or strong your bones are at that moment. It gives a number. That number helps guide decisions like diet, exercise, or sometimes medication. So it is useful, no doubt. But here is something many people don't realize. Bone changes are usually slow, very slow. They don't shift dramatically in a few months, or even in a short time span. So repeating this test too often does not always give new or useful information. Instead, it often shows very small changes. Changes that may not actually affect your health in a real way. But once you see a change on paper, it can create worry, and worry leads to action. Sometimes that action is unnecessary medication. Strong drugs that are meant to protect bones but can come with side effects. Some people feel stomach issues. Some feel muscle pain. Some feel weak or uncomfortable. And the question becomes, was that really needed at that moment? After 65, the body becomes more sensitive. Every medication needs more careful thought. Not because treatment is bad, but because balance becomes more important than ever. Now let's talk about something simple. If a person has had a bone scan and it showed mild thinning, and then they are already on a good plan like calcium, vitamin D, and light exercise, then repeating the scan too soon often does not change the plan. The treatment stays the same. So, what are we really gaining from repeating it? That's the question we need to ask. I've seen many older adults go through this. They do a scan, they are told slightly low bone density. Then they start medication. Then a year later, another scan is done, and the result is almost the same. Maybe a very small change, nothing major. But now the person feels anxious. Is it getting worse? Should I change something? Do I need stronger medicine? And suddenly, a simple monitoring tool has turned into a source of stress. That is not what we want. Because at this age, peace of mind is just as important as physical strength. Another thing people don't always think about is that bone health is not only about numbers on a scan, it is about daily life habits. Walking regularly, getting sunlight, eating properly, staying active in a safe way. These things often matter more than repeating scans again and again. A scan is just a snapshot, but your lifestyle is the real picture. Now, of course, there are situations where repeating the test makes sense. If someone has had a fracture, if there is a new strong risk factor, if medication is being adjusted and the doctor truly needs to see change. In those cases, yes, it helps guide care. But routine repetition without a clear reason can sometimes do more harm than good because it shifts focus away from living well and puts too much focus on a number. And numbers can be misleading when taken too often without context. Let me put it in a simple way. Imagine you are walking every day. You feel fine, no pain, no problems. But someone keeps measuring your walking speed every few weeks. Small natural changes will always appear. Some days faster, some days slower. But overall, you are fine. Still, if you only focus on those small changes, you may start thinking something is wrong when nothing really is. That's what can happen with bone scans, too. So the goal is not to avoid the test completely. The goal is to use it wisely at the right time, not just out of routine habit. After 65, we should aim for stability, not constant checking of everything that is already stable, because every extra test brings a little bit of stress, even if we don't notice it immediately. And over time, that stress adds up. So the better approach is simple, is do the scan when it truly helps guide a decision, not just because a year has passed. And in between, focus on what really strengthens bones every day. Movement, nutrition, sunlight, safe activity. Those things build real strength, not just the report on paper. So remember this. Bone health is not only about how often you test it, it is about how you live with it every day. And sometimes the smartest care is not another scan. It is trusting the stability you already have and not overchecking it. Now let's talk about something that many people find hard to hear, but it's very important. Aggressive cancer screening later in life. This is where we try to find every possible cancer as early as we can. On paper, that sounds like the best thing to do. Catch everything early, treat everything early, stay ahead of it. But after 65, the picture is not always that simple. Because at this stage of life, we are not just asking, can we find something? We also need to ask, should we treat it if we find it? And more importantly, will treating it actually improve life? That's the part people often miss. Let's understand it in a simple way. As we get older, the body changes. The speed of disease also changes. Some cancers grow very slowly, so slowly that they may never cause symptoms during a person's lifetime. A person might live their normal life, pass away from something else, and never even know that small cancer was there. Now imagine this. You feel fine. You have no symptoms, no pain, no warning signs. Then a screening test finds something very small, something that may never have caused trouble. But once it is found, everything changes. The word cancer is powerful. It creates fear, it creates urgency. Even if the problem is small or slow, the mind does not treat it that way. So, what happens next? More scans, more biopsies, more decisions, and then often treatment is suggested. Surgery, radiation, medication. All of these are strong steps. They are meant to fight disease, but they are not light on the body. And here is the part we need to think about very carefully. In older age, the body does not recover the same way it did before. Healing is slower. Energy is lower. Side effects can feel stronger. Even small treatments can affect daily life more than expected. So the question becomes very real. If a cancer is very slow and may never harm you, is it always worth going through strong treatment for it? Sometimes the answer is no. Not because we are ignoring health, but because we are protecting quality of life. I've seen cases where aggressive screening finds something very early, and technically that sounds like a success. But then the treatment brings weakness, fatigue, discomfort, and long recovery time. And the person spends more time dealing with treatment effects than they ever would have with the condition itself. That is a difficult trade because we are trying to help, but sometimes we end up reducing comfort without adding real benefit. This is why modern care in older age is slowly shifting. It is not only about finding everything possible, it is about choosing wisely what to look for and what to leave alone. Now, let me be very clear here. Screening is not bad. It saves lives. It is very useful when there is a real risk, or symptoms, or strong family history. In those cases, it is important and should not be delayed. But routine aggressive screening for everything without a clear reason can sometimes create more harm than good in older adults because it leads to a chain reaction. One small finding leads to more tests. More tests lead to more worry. More worry leads to treatment decisions that may not always improve life quality. And at this age, life quality matters deeply. Being able to move freely, sleep peacefully, spend time with family, enjoy food, enjoy normal days without constant medical stress in the background. That is real health, too. Another thing people don't always realize is that not all early findings need immediate action. Some can simply be watched carefully over time. That is called careful monitoring. And in many cases, that is a safer and smarter choice than rushing into treatment. But monitoring only works when we are not over testing everything again and again, because too many tests can lead to confusion. Small changes that are not important can start to look important, and that can push decisions in the wrong direction. So we need balance, not ignoring problems, but also not chasing every tiny finding as if it must be fixed immediately. After 65, medicine becomes less about aggressive searching and more about smart understanding. What is likely to help? What is likely to harm? What is truly needed right now? These are the questions that matter most. And sometimes, the hardest but wisest decision is to step back from intense screening when there is no strong reason for it. Because finding more is not always better, especially if what we find does not change how we live, but only changes how much we worry. So the focus should shift from find everything early to find what truly matters for this stage of life and protect peace just as much as we protect the body. Because at the end, health is not only about tests and results, it is about how well you can live each day without fear taking over it.